Hello, so I'm Maggie Gogashvili, and here's Laura Fernandez. Say hi. We're from COBATEST, from CSCAT, and today we'll be presenting data collection tools that we have for our members. Let me share our presentation. So as you can see, the presentation is being recorded. Please do let us know if there's problem with, if you have any problems with recording, because we're going to be recording a Q&A as well, I guess, in the end. Okay, so this is a presentation on, well, introduction to COBATEST data collection tools, key functions, and how to use them. This presentation forms part of peer-to-peer capacity building webinar, work package 3 of Boost. So let me start with those who do not know what's COBATEST network. Just 1 second, I'm trying to, the screen is bothering me, I'm sorry, I'm just gonna, okay, perfect. Okay, so COBATEST network is a network of organizations across Europe, community testing organizations across Europe and Central Asia, who offer community-based voluntary counseling and STI HIV testing services. And we have many objectives that I'm going to go through in a couple of slides. Currently, we're 137 members. We have 137 members across 29 European and 2 Central Asian countries. You can see here the map. Coordinators of the coordinating organization of the networks or secretariat. Well, one, it's us, CSCAT from Spain, and A Section Europe from Germany. So these are objectives of COBATEST network. As you can see, there's way more than just data collection. First one is to promote and to increase visibility of community health work, including community-based testing for HIV, STI, viral hepatitis, and TB across Europe. Second, to advocate for the inclusion of community-based testing into national policies across Europe. Also to generate, analyze, and disseminate harmonized data from community testing centers to be used and promote to be used at local, national, and regional level to improve the quality of such data. Also to strive to be representative of the realities of CBVCTs or community testing centers in WHO European regions, to increase the quality of community testing services in the WHO regions through capacity building and advocacy based on the needs of the clients, and to promote synergies and alliances with other stakeholders working with key populations, particularly in prevention and control of HIV, STI, viral hepatitis, TB at community level. So there's many benefits of being COBATEST networks, being part of COBATEST network, and these are just some of them. You have, as a member of a network, you have an opportunity to share your experiences with other members in Europe and Central Asia through yearly meetings or through online communication, make new contacts and partnerships, gain free access to COBATEST data entry tool that I'll be sharing in this presentation. Also, we're in the pilots, level of development of appointment tool for COBATEST members, which will allow you to manage daily client intake or scheduling, also again free of charge. It also helps you, being part of the network also helps you to raise awareness of your organization's concerns across European level, which means we're always part of scientific conferences and various projects where we demonstrate data and findings from COBATEST network and advocate for the objectives that COBATEST has. And the last and not the least, you can contribute to evidence base for CBVC programming in Europe and Central Asia. So this time for this presentation will just be concentrated on one part of the one objective of COBATEST, which is the standardized data collection. So once a year, which usually is March, our members send in data to COBATEST to be analyzed and to develop a yearly report with predefined indicators for prevention purposes. And there's three ways you can share data. We have, as I already mentioned, free online tool. We also have an option of sending in disaggregated data, which is, well, I'll talk about it later, but we do have a specific way of sending it. And you can also send aggregated data, which is also is done through an Excel file, predefined, pre-structured Excel file. And the reason of having these three options is just to give you less work, because we understand that many members do have their own tool. Not all of them. Many do use our online tool, but many do have them. So not to create more work, we just give other different options of sending in the data. But we do ask specific variables that are that match match the variables and indicators that we have pre-established. So aggregated data, as I said, it's pre-formatted Excel file which we share with members. I think this presentation will be shared with you after. So here you do have links to all of these documents, so you can take a look. We also have guidelines on how to submit this aggregated data, but as any other aggregated form of data collection, you just have to put in N for, in this case, predefined indicators. In case of disaggregated data submission, also we have a list of variables that we share with our members. So the reason we do this in order to have harmonized data, in order to be able to report all the indicators that we have to report, we do need those variables to be submitted. However, we do understand that not all variables can be submitted because not all of the centers can collect data on all of them. And we're flexible on that, but we do mark some that are obligatory or highly recommended to be submitted, and others that are welcomed, but we understand that that's not always possible. So this is how the left one is aggregated data submission form. This is how it looks. So you can see that there's indicators: severity 1, number of clients tested for HIV; severity 2, proportion of clients who report to have been previously tested for HIV. And we have several more indicators here, and the Excel file is separated by HIV and then other STIs. On the right side, we have disaggregated data Excel file. So here you can see how which variables we're asking for and how each variable is afterwards separated together with the values assigned to each of the answer. So all the instructions are very clear and very straightforward, and do not require much knowledge. And the last one is online data collection tool. So this is a tool that I'll be concentrated today. Well, what does it do? What does it has? Well, it gives you an opportunity to collect standardized data. It's very user friendly. It has different modules that you can select that I'll be showing and talking about. It's very easily to manage. You can change language of the tool. If we don't have already your language, you can always ask us to include this language in the data collection tool. And in that case, we do send an Excel file with all the variables that we need to be translated in your language. And then we'll do the translation then we will implement it into the program. It helps you, it lets you to extract and analyze data and be part of overall COBATEST report. So I'm going to kind of go through all of them and show you how it works. Any questions so far? So let me go on then. So yeah, as I said, it's very user-friendly and very easy to access. As you can see, it's accessed through our website right here, through COBATEST.org. You just go to login, and you have an option of, well, the website is in English or Russian. You just click login, put in the username and password, which is assigned to you after registration in the program by me. When you first open up the module, can you see my mouse? Do you see when I mark something?
Yeah.
Okay, perfect. So here, thank you, Laura. So here in the bottom, this is what the first page looks like. So you have adding new form, right? If you want to add new form, but all here you see your data, the data that you already inputted. So you have the ID, you have the date. So you have another ID in case you don't use COBATEST, automatically send identification code, unique identification code, and you use your own center. Then you have a name of the center, and then you have person who submitted this data. As in, it's not just you in your center who is filling in these forms online, you will have multiple names. And the last one, when you click in details, you can go in and see how this form works. So when you enter, if you click details or if you click new form and you enter in the form, this is what you see. So you have different parts, different tabs, as you can see here up, right? So the red ones are the general form, part of general data collection form. Okay, so you have identification as in identification of the person, and not, this is the information, this is the questions that are, so not identification as in name or the last name, but more of, when they presented at your center, which center, who took the test, who attended this person, and so on. Then results of testing, behavioral factors. I'm going to show in the end whole data collection form so you can see all these questions. STI vaccinations, screening, questions on screening, HIV has done, and questions on syphilis, SSV, hepatitis C, and hepatitis B. If these questions, if you are doing this test as well. Then if you would like to also have access to questions on PrEP and chemsex, if this is something your center is doing, you can also have access to these modules that you can see here are underlined in yellow. And then this is also a great thing that this program has. Network provides this option of adding your own module. So you can see here in blue, there is Belgium. Right here, you see Catalan because these are questions for, it is written in Catalan because these are questions for Catalan centers. Then you see module of Cyprus. So these are just three who asked us to have specific modules for their own countries, okay, or for their own use. It doesn't, in Cyprus, it's just one center, but it's for their own use. This gives you an opportunity to include in the questionnaire questions that are pertinent just to you. So you can use the general form, but there's other questions that are very, very specific to you and maybe are not useful to all the centers, but that's why it will not be included in the general questionnaire, but it can be part of the model, which will be just yours, and you will access just this model. And sorry, and we have from this year new module available, which is on other STIs. Okay. As I said, it's very easy to follow. You just have different tabs for different type of questions. Every time you, in the end, you just click save, or if you want to save it, you delete it if you want to delete it, or exit if you just want to exit. As I said, there are some mandatory questions. The ones that you see here highlighted in red box that we need in order to develop predefined indicators afterwards during development of the report, and their for it to be easy for you, so you don't have to remember which questions are those. They're marked in red. Also, some questions are hidden. Okay, so if you click, for example, on if you look right here, there's an example of risk exposure. Okay, so if you click risk exposure, it will give you as a reason for testing. Then you will see all these options to choose from. But if you don't click on risk of exposure as reason for testing, this question will be hidden. Okay, so after you hit save or exit, you come back to the main page. And the last form that you inputted will be the first one on your list. As I said, this program has an ability to, well, it gives you all these languages that you see right here, including my own here in the end, which is Georgian. It's written in Georgian letters. So all of these options are available in the program, so you can change the language of the whole program to your maternal language. If it's not here, if you don't see your language here, as I said, it's fine. And you can ask us for it, and we will send you Excel file with all the variables, and it can be translated to the language that you want, that you need for your daily use. And as you know, this is very important, especially if so many centers test differently, and especially for centers who are inputting data while they're talking to the client. Maybe the person who does this testing doesn't speak English or any of the languages that you have here. And it's important that we have language that is most commonly used in your center available. So this is why we have this option. You can, if you have more than one center, you have an opportunity to change the center. Okay, so you will be you can separate your data by center, by center A, by center B, and it gives you an opportunity. The program gives you an opportunity to check just the data of A and just the data of center B. Or if you want to be registered together, you can also do that and just have a center name here as a separator. So as you can see, it's very, very user-friendly. Yes, this is also a great tool it has, which is exporting your own data, and not just in an Excel file, which is one of the options. Okay, but it also gives you an opportunity to generate a type of report. So for example, well, if you do an Excel, it will be just all the data with all the variables that you inputted. It can be coded variables, as in it can be yes or no, or it can already be marked as 1 or 2. Or you can use a graph option. So if you click, so right here, in red, if you input dates that you want to look at and you click plot number, you will generate a report for selecting time period, okay? Like right here, which you can then, you can also export this. So it's a PDF file, but it can also be exported in an Excel file right here, marked in green. Or if you want to generate graphs and data by specific indicator that we have already defined, you can do that too, as you can see right here. So here I have selected number of clients that is for HIV with a screening test, and I wanted separation by risk group. Okay, so if I click this, then I will get a graph according to this. The examples here, I think, show, as I see, for HIV, syphilis, and hepatitis. Yes. So depending what you want to take a look, you can you can choose different options, and it will give you graphs of indicators that you want to see. So basically, if you're not using this for scientific purposes, but you need it for reporting, you need it for easy reporting for your own center, for donor or whatever, this will already give you pre-calculated, this will already give you graphs that you can use for your reporting. So this is also a report tool that you just, as I said, we have predefined indicators. We have 9 indicators. And so if you want to see if you want to get a PDF report just with these 9 indicators, you can select here the date, just the first part. This ones you don't have to touch. You just put in the date and you'll have this kind of indicator separated by key population group, gender, and age. Also, very useful when you plan your interventions or when you have to just report to your donor or have it for your own purpose, for your internal purposes. Any questions so far before I move on to data collection? If you want me to show you the online tool, because here you have screenshots, but I can also show you the online tool itself. I can do that as well. Do you think that will be helpful?
Yeah, I
Anyone?
think that could be a good idea.
Yeah. Okay. So let me stop sharing this, and I'm going to share the tool itself. Okay. Can you see it? Yeah.
Yes.
Yeah, perfect. So this is our website. It's COBATEST website that I'm going to show you later as well, because I'll show you where all the data collection instructions and forms are stored. So when you access data collection online tool, you just have to sign in on you have to log in on our website and just click login. It's already set. Put your username and password, something that you will get from us. And here it is. Let me just change it to a test center so I don't show you data of anyone. Okay, so here it is, new form if I want to add the form. And then you have all these tabs and you just go through them one by one. Those are the variables that I said that are mandatory. You have questions on STI vaccination, then specific questions on HIV testing. And as I said, if you click on some of the answers, there are some questions hidden, so they will come up after you click them. You have syphilis, you have hepatitis C and hepatitis B. Then you have questions on PrEP with hidden questions and on chemsex also. And then we have specific, and we have STI that was recently added. Questions that we have for now are on chlamydia and gonorrhea. And then you have specific questions, models for specific countries in their own languages. And when you want to come out, if you want to save the form, you click save or delete or just exit without doing anything. And you'll see the last form you entered at the top. And here, as I mentioned, you have an option of changing language. Here, that can be added any language that you want. Change the center, right? If you have more than one center now, because we logged in with my ID, I see all of the members, but in your case, you will just see your center. And if you are one organization with more than one centers, and you want to see all of them, you can see all of them. Also within the rights that we give to the users, you can differentiate. If you are a coordinator who wants to see data that is entered by everyone from your center, you can have a coordinator role assigned as when we assign you a username for this tool, and you can see everyone's data, but you can limit limit rights of your colleagues and just let them see their own data and extract their own data, as in data that they entered. So here you have these export options that I said. You can export it as a form, as an Excel file. create a graph or create report with the indicators. And those are predefined indicators that form part of our report, which I can also show you when we go through the website. Any questions? Okay. So let me go back to the presentation. Okay. Right. Okay, so as part of so we're part of the Boost project. So as part of the Boost project and core project, we tailored COBATEST data collection form to harm reduction community testing centers and other key population groups. So we used the consent decision-making method to argue the questions that will be adjusted or added to the form with the expert groups from communities and from the centers, members of the Boost. So after this, after we used the consent decision-making method, we agreed on various changes, and most of them were it covered various aspects of drug use and other needs of PYUDs, right? And here are here are just, some summary phrases for it. So we added the part of main routes and frequency of drug use, main drug use, sharing materials for injection, non-injecting drug use, injection in prison, opioid agonist treatment, experience of homelessness, and HPV testing in addition to existing HIV, HSV, and syphilis questions. So all of this, as I wrote here in bold, all of these modifications were done with the aim to collect comprehensive data, potentially contributing to significantly to improve the service provided and policy making, to inform policy planning. Sorry. So okay, so now I'm going to go through the whole form, just not discussing each question, but for you to see what changes have been made. So let me go back. So this, as I said, this presentation will be shared with you, so you can always, and you can click here because I have links embedded in many of the slides. You can click on here, for example, on that general data collection form, and you can see the whole form and download it in a PDF format. Oh. Let me change back to the website. Oh. Okay. So do you see this? No. Do you see this? Do you see the online tool?
Yeah.
Yeah, okay. So this is data collection form in shape of PDF, because for the centers who do not use the online data collection form, or also for tool, or also for the ones who do use, but they don't input data right away when they are with clients and they like to, submit, fill in paper version first. So here you can see that in the start, we have general questions, date of visit, who provided the testing, the unique identifier, which helps us to, identify users, or if you don't want to use this, right here. If you don't want to use our unique identifier, you can use your own. Our user identifier, sorry, is comprised of several parts: gender, day, month, and year of birth, number of older brothers, number of older sisters, and then initial letter of your mother's name. So this gives you a unique identifier that then will allow us to follow you throughout a year, but in no means we can identify who this person is. Then you have the part on client characteristics, right? You have gender, you have date of birth, the nationality to identify immigrants, and then immigrants this year we also, well, last year actually, we also separated in many forms, many levels to be able to identify just not to have immigrant, not immigrant, and no vulnerability of if each immigrant is different, right? So here we give you an option of foreign student, foreign worker, asylum seeker, and so on. And we also have an option of other. We ask questions on healthcare access, and it's free. We refer to free healthcare services. And as I said, we added question on homelessness because it was found as important in the context of PYUDs. You have an option. You have a section on reasons for testing. If you have tested in the same center, and then we have behavioral factors. So here, a lot of questions have been modified and added with PYUD in mind. You can see here that we asked sex in the last 12 months, with who, condom use, if they received money, drugs, goods, or services for sex, STI diagnosis in the last 12 months, drug use, and we separated it into routes. And we also asked questions on the frequency. We also added main drug use and give an option to select, and also an option of other. We have a section, we have part on a question on using material of injection, right? Last 12 months, and of non-injecting drugs as well, last 12 months, and also a question of drug use in prison, and if they are on opioid agonist treatment currently. Next sections are on, next section is on STI vaccinations for hepatitis A, B, papillomavirus, and Mpox, monkeypox. And then we have already specific questions for testing for HIV, right? Together with questions on if they have been referred to healthcare, or if they have been linked to healthcare. We have questions on syphilis testing, same referral and linkage to care questions in the end, HSV, HPV, and that's it. So this is the main form. So we always try to keep it as short as possible, because we understand that it's very hard to ask all these questions when you are with the client and you have limited time, and also maybe a client doesn't feel they don't want to answer questions, or it's just too many questions for them. So we always try to keep it short and to the point. And when these questions were developing and the adjustments for harm reduction centers were done, everyone had this in mind. We understand that there's way more questions that we can ask that can be very useful for you or for us, for academia, for anything, but we have to be realistic and just have the questions that are main questions at this moment that will really inform you on something that you need to know right now. We do go through these forms every year, and if something has to be adjusted because things change, we do adjust them. But for the main form, we always try to keep it as short as possible, and it's just one paper, sorry, so front and back. And then if you want to ask more questions or collect more data, we do have form on PrEP and chemsex. So in online form, it's a separate module. In PDF or in paper, it's just one separate page. So if your center is collecting data on PrEP and chemsex, or they want to collect data, you have this option as well. Right here, you see first general questions, which is date of visit and unique identifier. And then you get questions on PrEP. And then you get questions on chemsex. So these questions also have been reviewed in context of harm reduction centers and what are important. And they have been developed thinking of this point. Same with chemsex questions. So you have you ever heard about PrEP? If you click yes, well, in this case, you just have to follow indications, but in case of online model, the questions will appear according to what you answer. So if you click yes, then you'll be asked if you have ever taken PrEP. If you answer yes, you will be asked if it was prescribed and if it was monitored. If you click no, it will ask you if you're interested in using PrEP. And if you click yes, then you'll be asked if client was referred to PrEP. And if no, then you have an options of indicating why no with option of other. With chemsex as well, you have have a question. So this question was also modified to be more inclusive and precise. It asks you if you have used drugs for the purpose of enhancing sex. If you answer yes, you have 2 more questions on when was the last time and which specific drug. And again, these questions we understand there are a lot of questions you can add to it, but we always try to make it as concise as possible and to the point. Any questions so far? Okay. And let me move on to the third form. So this is data collection form, which is new. It's for other STIs. We implemented it this year. And again, this is a separate form. It's not part of a general data collection form. So if your center is collecting data on chlamydia and gonorrhea, or they want to collect data on chlamydia and gonorrhea, they can ask access to this model, or if they're using the data collection online tool, or just this paper, which is also this PDF, which is also available on our website. And it gives you an option. So as you see in the start, again, general questions. Then there's questions on previous STI testing. And then you have questions on chlamydia and gonorrhea specifically. Okay, let me go back to the presentation if there's no questions on these forms. Okay, so we already went through all this. Yeah, so there's multiple instructions available on all of this. So we do have actually manuals, instructions that you can use, and you can see how data should be submitted when it's in aggregated form, in disaggregated Excel file, or how can you use an online tool, so manual for online tool use. We also have videos explaining online data collection tool. It's available in English, Russian, and Spanish, and in Spanish, yes. And we also have a recording of a training that we did on all of them last year, all of them available on our website. So let me just go back again. I guess it's the last part that I want to explain. Website, and show you the website of COBATEST when you can see all this data. All the instructions, sorry. Okay, so we're back on our website. If you go to menu and go down to data collection tool, right? I'm there already. So here you can see how to collect data collection, first data collection forms that I showed you. So you can see that it's already in different languages. Again, so when you ask us for translation of the online tool or translation, you can also ask us translation of the form itself in your language, and you can access it from our website. You have instructions on how to use it. So in instructions, you also see definition of. Let me show that definition of each part, right? So it goes part by part, explaining what each question means. Because as you know, we interpret the questions differently. We can interpret questions differently. So we thought it was important to have sort of a dictionary, variable dictionary, so you know exactly what each question and each answer entails. So you have this on our website. You have modules that I just showed you, right, in different languages as well. So PrEP and ChemSec module, ChemSex module, other STIs module. For now, it's in English, Catalan, Spanish, Italian, French, Romanian, and Hungarian. So this is just because these members from these countries asked us to translate. It's always available in English, but the rest are upon request. As I mentioned, there are manuals for data entry and also written instructions and also video tutorials on how to use online data collection form. And here you have, if you're choosing, if you're not choosing data collection form, online data collection tool, you can have an option of aggregated data submission and disaggregated data submission. And you have instructions and Excel file where you can submit aggregated data, and also Excel file with a list of all the variables for disaggregated data submission. And here are all the indicators that I was mentioning before. So as I said, we have predefined indicators that we report at the end of the year. So the first one is number of client tests for HIV, then proportion of clients who reported to have been previously tested for HIV. And in this PDF, you also have, how you can also see how we calculate it. Third indicator is proportion of clients who report to have been tested for HIV during preceding 12 months, proportion of clients with a reactive screening HIV test result, proportion of clients with reactive HIV screening test result who were tested with confirmatory HIV test. Then proportion of clients with positive confirmatory HIV test result, proportion of clients with false HIV positive result, number of clients need to test to find the positive HIV result, and cost per client screened for HIV. Yes, we do have more indicators, but they do not form part of the report, but we do have them available. And then all of those repeat for HSV, syphilis, hepatitis B, and other STIs since this year. So you also have this available on our website. And to show you the product of data collection in one of the products of data collection in COBATEST, we generate annual reports. So this is the last one. And you can see with all the activities that have been done, let me go back, that are done in COBATEST during this year. But let me go to the results. Okay, so in results section, you will see all the indicators that I mentioned, calculated and presented and analyzed and compared to other years of COBATEST network data collection. So in this case, 22 was compared to 21, or if there was some significant difference with other years, that will also be mentioned. This is how they're presented, right? So this goes for all the indicators. And then in the end of the report, we also do, sorry about this, we also do per center reporting. So you also have your center with your ends and your indicators, right? So besides this, we also, let me stop sharing this. So besides report, we also generate abstracts and articles using data collection tool, serving objective of sharing all important work that community testing centers are doing, and then again advocating for their inclusion in national surveillance system and inclusion of this data and results to intervention planning or health planning in respective countries. Yeah, so that's why harmonized data connection is very, very important. I guess that is it for the presentation. If you have, any questions about COBATEST network or data collection, you can contact me or Laura. And now, if you have any specific questions for me, or Laura will gladly answer you.